the organizing committee, especially Professor Kocha, for giving me this unique opportunity to be with you and participate with my co-chair for this very interesting session. Since we have run out of time, I would like to proceed quickly to our next presentation, which is titled as Regulation of Parathyroid Hormone Secretion in Normal Subjects. This study comes from Italy by Drs. Danese, Ferrone, Cipriani, Fassino, Pepe, and Dr. Minisola. Please, Dr. Minisola.
Many thanks for the invitation. I will try to be as short as possible, also because some of the data were presented last year. As you know, there are a huge number of factors that potentially can influence PTH secretion. Among them, the most important are serum ionized calcium and calcidiol, even though calcidiol, FGF23, drugs, and other factors can influence secretion. The results I will present are the end results of a very long study initiated some years ago when we demonstrated that there was an inverse relation between 25-hydroxyvitamin D and PTH. There are some other kind of relations that are described with different inflection points, but according to us, there was a direct inverse relationship. And continuing along this pathway, we showed, this is one of the first papers showing that there was also an inverse correlation during the winter and the sun period, and there was an oscillation of the two parameters during the year. Then we showed about 10 years ago that after a huge dose of vitamin D administration, at least 300,000 international units taken by mouth, there was an inverse relation between vitamin D and 25-hydroxyvitamin D PTH, in the sense that the increase in 25-hydroxyvitamin D was able to decrease serum PTH level. And at that time, we did not take into account what we wrote in the paper, that among all the variables considered, 25-hydroxyvitamin D plays a significant role in influencing PTH serum level. Then, about 2 years later, administering 600,000 international units of vitamin D, also in this case, we were able to show that increase of 25 and also 125, there was a concomitant decrease in PTH secretion. What is important in this last study, there was just a small increment of serum calcium after 3 days, but there was a huge variation of PTH 184 with also a huge variation of 25-hydroxyvitamin D level. So also in that case, despite a small variation in serum calcium, there was very huge variation in serum PTH level. But another important point that is not taken into consideration very much is what happens in patients with renal failure, in which they give 125 to decrease serum PTH and without any bigger changes in serum calcium. This is one of the last studies. If you concentrate to the A, D, and F, these authors gave concomitantly both denosumab and 125. You can see that there is a huge increase in D in 125. There is a huge decrease in PTH concomitant with a decrease in serum calcium. So this is contrary to what is the physiology that is written in the textbook. So this study was carried out in more than 2,000 patients in order to see which are the main parameters that influence parathyroid hormone secretion. These are the main anthropometric and basal biochemical parameters. These subjects were all blood donors volunteers, so by principle, there were healthy subjects. There was what we expect, an inverse relationship between ionized calcium and PTH, but there was also an inverse relationship between 25-hydroxyvitamin D and PTH. I don't have time to go through the enormous mass of data we generated, just to show that also with body mass index there was a direct correlation in the sense that obese people have higher levels of PTH, but this relationship is most probably mediated by low 25-hydroxyvitamin D that is sequestrated in the fat. And just to make a very long story very short, the main results of our study indicate that in young subjects, perhaps 25-hydroxyvitamin D is the main regulator in stable conditions, not in acute condition, of parathyroid hormone secretion, while in patients, in older patients, ionized calcium has an influence for those patients that have serum values of 25-hydroxyvitamin D higher than 30 nanogram ml. And what is important, this kind of correlations was substantiated by 3 different statistical approaches. And just to be very simple, if you read the text in red, 25-hydroxyvitamin D accounts for about 32% of variation in PTH secretion, while in a stable condition, we are not talking about acute condition, when you decrease immediately serum calcium levels, so you have an increase in PTH secretion, but in stable condition, vitamin D is more important, at least according to us, than ionized calcium in regulating PTH secretion. So at the end, we speculated average PTH levels are mainly influenced by 25-hydroxyvitamin D in younger subjects than in older subjects in stable conditions. And in older subjects, ionized calcium seems to be more important in regulating the average level of PTH for higher vitamin D level. So in conclusion, we suggest that vitamin D acts directly at the level of parathyroid glands in a stable condition, whereas it is converted to 125-hydroxyvitamin D, it is able to decrease parathyroid hormone secretion independently of serum calcium level. Thank you for your attention.
Thank you very much, Dr. Minisola, for your in-time presentation.
Timely presentation.
Thank you very much. Are there any questions from the audience, please? Any questions? Yes, please. Short question, please.
I'm delighted from your cutoff levels. Is what we have found equally in a population of 8,000 patients in, let's say, hospital samples in which we had a cutoff level of 18 for the PTH, very related to the 14 you have here. And just an observation, all your correlations were in log-log, meaning that you have
that there are some skewed values. Yes, sure. Thank you for your comment. But this is I don't know if you are familiar with the story, with the long story. This paper was just rejected 2 days ago because the authors said, we are saying nothing new. It's evident from the literature. But if you go to the text of physiology, you say that, still say that ionized calcium is the main regulator of parathyroid hormone secretion. If you are following the story of vitamin D and PTH, you can say that everyone has his cutoff point for the increase in PTH. You can put the point here or here, depending on you want. And there are a lot of theories that are being built on this. But In any case, I hope that next year, if there will be a next year, this paper will be accepted, perhaps.
Sorry, I have two brief questions. With respect to the association between BMI and PTH levels, you said that it was mainly determined by 25-hydroxy. Is that an independent association? I mean, if yes, how do you explain this? Are there any other mechanisms for the effect of BMI on PTH levels?
As also you said, I think that this relation doesn't exist anymore if you correct for the level of 25-hydroxy vitamin D.
And what about magnesium? Did you find any association with PTH?
Yes, I had no time because there were a lot of parameters. We found a strange situation with magnesium because contrary to ionized calcium level, there was a slight direct correlation in the whole population. However, if you separate males from females, the correlation does not persist, showing at least for us that perhaps the huge number of patients is the most important driving factor, because otherwise you will have found the correlation both in males and females separately.
Okay, thank you very much. So let's proceed to the next.